Dear students, good morning. Our lecture today, immunopathological process. Immunopathological process. So, let's start. Immunopathological process. This is pathological conditions that are associated with a violation associated with violations of the structure and function of the immune system. Pathological conditions that associated with violations of the structure and function of the immune system. Immunopathological process include pathological change in the organs of immune system, pathological change in the organs of immune system, and impaired immune response. Impaired immune response. Some short histology informations about structure and function of the immune system. Immune system include central and peripheral organs. Central organs, this is bone marrow and thymus. Central organs, bone marrow and thymus. And peripheral organs include spleen, lymph nodes, and lymphoid tissue, mucosa, associated lymphoid tissue, mucosa associated, and skin associated lymphoid tissue. Primary and secondary organs. About function. Precursors of T and B lymphocytes, as well as neutrophils, eosinophils, basophils, monocytes are formed in the bone marrow. In the bone marrow, formed precursors of T and B lymphocytes. In the thymus, T lymphocytes are formed and pass antigen-independent differentiation. In the thymus, T lymphocytes are formed and pass antigen-independent differentiation. The peripheral immune system organs carry out immune surveillance. And also take place here reproductions and final differentiations of cells of immune system. Immune surveillance and reproductions and final differentiations of cells of immune systems in peripheral immune systems organs. The main immune cells, this is T lymphocytes, B lymphocytes, and macrophages. The functions of T cells is to identify one's own and ours. Identify one's own and ours and transfer informations to B cells. Transfer informations to B cells. Transfer informations from the macrophage system. Transfer information by B cells and from macrophage system. And B cell function is the production of antibodies. B cell function is the production of antibodies, immunoglobulins. Immunoglobulins production. Thymus pathology. Thymus pathology includes accidental involution, atrophy, aplasia, hypoplasia, dysplasia, thymomegalia, and hyperplasia with lymphoid follicles. Accidental involutions of the thymus. Accidental involutions of the thymus. This is reductions of the thymus in size and mass. Reduction of the thymus in size and mass due to the migration of thymocytes, to peripheral immune organs and blood. Migrations of thymocytes to peripheral immune organs and blood, as well as their apoptosis. Causes for accidental involution. Various stress conditions, fasting, X-ray irradiation, Next causes: medicamental treatment, for example, hormones, cytostatic drugs, Next causes: infectious disease, Next, hemoblastosis, and malignant tumors in children. Morphological manifestations, accidental involutions include 5 phase or stage. Phase number 1. Just normal conditions. Phase number 1. Absent morphological change. Normal conditions of the thymus. corresponds to unchanged times of healthy child. In this stage, no morphological change. Phase number two. Phase number two. Characterized by the focal loss of lymphocytes, in the cortex, focal loss of lymphocytes in the cortex, and active phagocytosis by macrophages, active phagocytosis by macrophages. Appearance of picture morphological picture, stereosky. Next, phase number three, characterized by depletion of cortical lymphocytes, depletions of cortical lymphocytes. As a result, formation, inversion of layers. This is inversions of layers means medulla becomes darker, medulla zone becomes darker than cortex, medulla zone becomes darker than cortex due to more content of lymphocytes. Medulla becomes darker than cortex due to more content of lymphocytes. In this phase, activations of reticular epithelial cells, and formations of new thymic bodies. Activation of reticular epithelial cells and formation of new thymic bodies. Next, phase number four, characterized by the collapse of the lobulus. Layers become indistinguishable. And thymic borders are large. And often form cystic cavities. Thymic borders are large and often form cystic cavities. And finally phase number five, characterized by the narrowing of the lobulus. Connective tissue expands. Lymphocytes and thymic borders are small. And many of them are calcification. calcification, form of calcification in this stage. Microscopically change in accidental involutions over thymus. You can see in the slide cortex zone, whitish zone in the cortex, and medulla zone. Whitish zone because absent T lymphocytes. T lymphocyte transform to medulla zone from cortex. T lymphocyte transform from cortex to medulla zone. Inversions over layers. Medulla zone, many lymphocytes, and cortex zone, absent lymphocytes. Outcome and complications with pathology. Outcome, this is atrophy of the thymus. Atrophy, it is outcome, unfavorable outcome, atrophy of the thymus. And this pathology accompanied by decreased activity of cellular and humoral immunity due to atrophy, formation, violations of immunity response, decreased activity of cellular and humoral immunity. This is immunodeficiency syndrome. Other pathology of thymus. Let's talk about other pathologies of the thymus. Thymus atrophy. This is unfavorable outcome of involution. Unfavorable outcome of involution. Morphological change. Atrophy, reduce in size, reduce lobulus, calcification in thymus, and growth of connective tissue. Next pathology, thymus aplasia. In this case, thymus tissue is detected only microscopically. Thymus aplasia. Thymus tissue detected only microscopically. Agenesis. This is complete absence of thymus. Agenesis. Next, hypoplasia. Significant reduction in size. Significant reduction in size. Next, dysplasia. No division into cortex and medulla zone. Dysplasia. No division into cortical and medulla zone. And number of lymphocytes is reduced. Number of lymphocytes is reduced. Next pathology of thymus, thymus hyperplasia. Thymus hyperplasia or thymomegaly. Thymus hyperplasia or thymomegaly. The thymus gland sharply increased in size and mass. Thymus gland morphological change. Thymus gland sharply increased in size and mass. Microscopically change. Microscopically, the abundance of immature lobes. Abundance of immature lobes. Absent zoning. Absent zoning. And present high density of thymocytes. High density of thymocytes. Complication this pathology, thymus hyperplasia, develop sudden death syndrome. Sudden death syndrome. No zoning with hyperplasia, no zoning and increase lobes in size. And thymus hyperplasia with lymphoid follicles, you can see in the slide, with lymphoid follicles, epia follicles, and perivascular space extended, and contain plasma cells, B lymphocytes, next groups of immunopathological process. Next groups. This is immunodeficiency syndromes. Immunodeficiency syndromes. Immunodeficiency syndromes are disorders of the immune system, with lost ability to the normal immune response. Lost ability to the normal immune response against antigens. And lost other immune function. Lost ability to the normal immune response and lost other immune functions. All immunodeficiencies are divided into two groups. Primary immunodeficiency syndromes, congenital, and secondary, acquired. Two groups, primary and secondary. Primary immunodeficiency syndromes associated with the genetic block of the immune system primary immunodeficiency syndromes associated with the genetic block of the immune system during ontogenesis. During ontogenesis. With the violations of proliferation and differentiation, violations of proliferation and differentiation of immune cells. Violations of proliferation and differentiation of immune cells. Primary immunodeficiency syndromes may be associated with deficiency. Cellular immunity. Cellular immunity. Cellular immunity, for example, DiGeorge syndrome. This is thymus hypoplasia. DiGeorge syndrome. Thymus hypoplasia. Member 2 associated with humoral immunity. This is Bruton syndrome. Bruton syndrome. The complete absence of immunoglobulins. Bruton syndrome, the complete absence of immunoglobulins. And cellular and humoral immunity, both cellular and humoral immunity. It's mixed deficiency. Combined mixed deficiency. This is primary immunodeficiency syndromes. Now about secondary immunodeficiency syndromes. Secondary immunodeficiency syndromes. Secondary immunodeficiency syndromes. Secondary immunodeficiency syndromes occur under the influence of exogenous and endogenous factors during a person's life. Secondary immunodeficiency syndromes occur under the influence of exo and endogenous factors during a person's life. What is factors during a person's life? For example, leukemia, malignant tumors, viral infections, for example, HIV infections, tuberculosis, sepsis, chronic viral infections. Next causes: Treatment pathology. Treatment pathology. This is maybe radiation therapy. Radiation therapy. Corticosteroids. Corticosteroids. Suppressants. Operation, for example, thymoectomy. Thymoectomy. Or anti-lymphoid serum use. Use anti-lymphoid serum. Next, etiological factors and alimentary factors. Maybe alimentary immunodeficiency. Alimentary factors. Deficiency of proteins, vitamins, and microelements in food. Maybe senile form immunodeficiency. Senile form immunodeficiency caused by aging of the body. Caused by aging. Senile immunodeficiency. And next factors, long-lasting intense stress. Long-lasting intense stress. Chronic distress. Chronic distress. Clinical and morphological signs of immunodeficiency syndrome. Clinical and morphological signs include formations, various complications due to sharply decrease immune response. Complications, for example, formations opportunistic infections, opportunistic infections, opportunistic infections, bacterial infections, bacterial infections due to defect of humoral immunity, defect of B cells, and as a result, bacterial infections. Next complication, viral infection, due to defects of cellular immunity. Viral infection formation due to defects of the cellular immunity. Viral infections, for example, herpes, cytomegalovirus infections. And next, morphological change and complication. This is tumors, especially malignant tumors in patients with HIV infections. Tumors appear due to a defect of the anti-tumor immune surveillance. Tumors appear due to defects of the anti-tumor immune surveillance. So, students, next group, immunopathological process. Next groups of immunopathological process. Just hypersensitivity reactions. Hypersensitivity reactions or allergy. Hypersensitivity reactions or allergy. Hypersensitivity reactions, that is manifestations of an overly pronounced immune response. Manifestations of an overly pronounced immune response. Develop in sensitized organism. Develop in a sensitized organism under the influence of antigenic stimulation. Under the influence of antigenic stimulation. Hypersensitivity reactions can be initiated. Antigen interaction with the antibody. Antigen interaction with the antibody. Immune complexes reactions. Antigen complex with antibody. And can be initiated cellular immune mechanism. Cellular immune mechanism. An antigen that causes allergies, antigen that causes allergies, is called an allergen. Let's talk about classifications of form of allergy depending on the nature of allergen. Nature of allergen. Type of allergen. Maybe allergy to external antigens or exoallergens. For example, allergic bronchial asthma and pollinosis, exoallergens. Next groups, it is autoallergy, allergy to its own antigens, autoantigens. This is a form of autoimmune disease. Result of autoallergy, formation autoimmune disease. And next groups, allergy, graft versus host reaction. Aggregations of the immune factors contained in the graft against the recipient organs and tissue. Next classification classifications of forms of allergy according to the rate of change. Classifications of forms of allergy according to the rate of change include two groups: immediate type allergy immediate type allergy, immediate type hypersensitivity reaction, and delayed type, delayed type, delayed type hypersensitivity reactions. Immediate type, immediate type allergy usually develops within a few minutes. Usually develops within a few minutes. Tissue change in the form of acute immune allergic inflammation. Acute characteristics: acute immune allergic inflammation. Development of ulcerative exudative inflammation, ulcerative exudative inflammation with marked tissue swelling, ulcerative exudative inflammation with marked tissue swelling, tissue swelling. Examples: immediately type are angioedema, and anaphylactic shock, You can see in this slide acute laryngeal edema, as a result of anaphylactic reactions. You can see reactions of edema and hyperemia. Edema, swelling, and hyperemia. Next type allergy, delayed type allergy. Develops in 24 and 48 hours. Develops in 24 and 48 hours. Formation tissue change in the form of chronic immune inflammation, chronic immune allergic inflammation. Chronic immune inflammation present lymph and monocytic tissue infiltration. Lymph and monocytic tissue infiltration. This is productive inflammation. Example, delayed type allergy. This is tuberculin reaction and contact dermatitis. Tuberculin reaction and contact dermatitis. In this slide, contact allergic dermatitis. Focus of hyperemia, inflammation signs, edema, and hyperkeratosis due to chronic inflammation. Next questions: immunological mechanism of hypersensitivity reactions. Immunological mechanism of hypersensitivity reactions. Immunological mechanism include four type. Type number 1, anaphylactic type. Allergic reactions in this type. Allergic reactions developing under the influence. Allergic reactions developing under the influence of immunoglobulin E. Reagents. Allergic reactions developing under the influence of immunoglobulin E. Immune response is accompanied by the release of vasoactive and spasmogenic substance. Immune response is accompanied by the release of vasoactive and spasmogenic substance. Characterized by edema, plethora or hyperemia, plethora of microvessels, and bronchospasm. Morphological change. Signs, pathological signs. This is a picture of acute immune inflammation. Examples. This is type, anaphylactic type. Allergic rhinitis, conjunctivitis, bronchial asthma, and food allergies. Next, type number 2. Type number 2, antibody-mediated type. Type number 2, antibody-mediated type. Antibodies are involved in the damage. Making the target cells susceptible to phagocytosis or lysis. Antibodies making the target cells susceptible to phagocytosis or lysis. This is complement-dependent reaction. This is complement-dependent reaction. For example, in case of uncountable blood transfusion, fetal erythroblastosis, autoimmune hemolytic anemia, agranulocytosis, thrombocytopenia, and drug allergies. Next type, allergen, type number 3. This is immune complex disease. Immune complex disease. Immune complex disease, the interaction of antibodies with antigens, leads to the formation of immune complexes. Activating complement. Complement attracts neutrophils. That cause tissue damage. Complement attracts neutrophils that cause tissue damage. Immunocomplex disease include two variants by localization: systemic immune disease and local immunocomplex disease. Systemic immune disease, for example, acute serum sickness, glomerulonephritis, and collagen disease. And local immunocomplex disease, this is Arthu's reaction, for example. Arthu's reaction, local, this is local immunocomplex disease. Local necrosis due to acute immunocomplex vasculitis. As a result of injections of anti-tetanus serum. After acute immunocomplex vasculitis appear after injections of anti-tetanus serum. You can see in this slide Arthu's reactions, skin reactions to introductions of heparin, morphological change in focus of heparin use, painful erythematous plaque, erythematous spots with necrosis, focus of necrosis. focus of necrosis and surround focus of inflammations and edema. Erythema. Next type, reactions. Next type, number 4. Develops as a result of cellular immune response. Develops as a result of cellular immune response. Cellular immune response. Cellular immune response involving sensitized lymphocytes. From 24 hours time, from 24 hours to 2 weeks. This is type of reactions. Appear in response to microbiological agents. For example, mycobacteria, viruses, fungi, protozoa, parasites, microbiological agents. Next causes contact skin sensitivity to chemical factors. Formation contact dermatitis. And this type include to graft rejection reaction. Next groups are immunopathological process, autoimmune disease. Autoimmune disease, a group of disease. Autoimmune disease, a group of disease which are based on the immune response. To the body's own tissues. Based on the immune response to the body's own tissues. Autoallergy. Our name, autoimmune disease, autoallergy. Mechanism of autoimmune disease. Violations of the physiological isolation. Violation of the physiological isolation of organs and tissues with to immunological tolerance. For example, in the brain, testes. Next mechanism. Primary disorders of immune system. Primary disorders of immune system that is no longer able. Primary disorders of immune system that is no longer able to distinguish own and foreign antigens. Primary disorders of immune system. And next mechanism, appearance of new foreign antigens. Appearance of new foreign antigens. Etiological factors for autoimmune disease. Etiological factors. HLA genes. HLA genes. Hormones, and genetically determinate features of target cells. Genetically determined features of target cells. Features of target cells. Next factors, viral and bacterial infections. Viral and bacterial infections. Next, chemical and physical impact. Chemical and physical impact on the immune system. And target organs. Target organs, chemical physical impact on the immune system and target organs. Next, dysfunction of the immune system. Dysfunction of the immune system. And suppressor activity of T lymphocytes. Dysfunction of immune system and suppressor activity of T lymphocytes. Autoimmune disease. Autoimmune disease subdivided into two groups. Organ-specific autoimmune disease and non-organ specific autoimmune disease. Organ-specific autoimmune disease develop as a result of damage of histohematogenous barriers. Organ-specific autoimmune disease develop as a result of damage of histohematogenous barriers and are characterized by the primary lesions of any one transbarrier organ. Characterized by the primary lesion of any one transbarrier organ. For example, thyroid gland, pathology of thyroid gland with Hashimoto thyroiditis. Hashimoto thyroiditis, just autoimmune thyroiditis. Or thymus with autoimmune thymus. autoimmune thyroid. And next groups: autoimmune disease, systemic or non-organ specific. Non-organ specific autoimmune disease. Distinguished by the primary involvement of many organs. In organ-specific autoimmune disease pathology, only one transbarrier organs. In the systemic autoimmune disease, damage of many organs. In the process, involvement of many organs in the process. For example, systemic lupus erythematosus, systemic lupus erythematosus, erythematosus, and rheumatoid arthritis, and systemic scleroderma, and dermatomyositis. It is examples for systemic non-organ specific autoimmune disease. Dear students, our topic today is finished. That's all. Thank you for your presence and thank you for your attention. Goodbye.